Hello, my name is Dr. Appel from Ado Psychology Center, where we specialize in treating anxiety, depression, and OCD. Welcome to our video seminar series. Hope you enjoy this video. This video is on depression. So the goals for this video are to understand clinical depression and to learn about treatment. I'm going to be discussing two depressive disorders. The first one is the one that's spoken of more, called major depressive disorder. And then there's also persistent depressive disorder, which we'll talk more about soon. Begin with major depressive disorder. The criteria for major depressive disorder are pretty straightforward. There are 9 symptoms, and if you meet 5 out of these 9 symptoms during a 2-week period, you likely have major depressive disorder. So first, before you get into all 9, you have to either be experiencing depressed mood, which is feelings of sadness, hopelessness, low mood, or a loss of interest or pleasure in things that you used to enjoy doing. It's also referred to as anhedonia. So if you say that you don't feel like very sad or very down, but you're just not interested in doing anything the way you used to be interested in doing things, or when you do stuff, they don't really give you much pleasure, then then technically you are meeting one of these two criteria. So there are 9 symptoms in total. You have to meet 5, but one of the 5 have got to be either depressed mood or loss of interest or pleasure in doing things. And now we're going to get into what the remaining 7 symptoms are. So the remaining symptoms include significant variation in weight or appetite. So losing or gaining more than 5% of your weight, or changes in appetite, eating more, eating less. Insomnia, so trouble sleeping, or hypersomnia, sleeping too much, more than usual. Psychomotor agitation or retardation, so kind of either being agitated or slowed down. Fatigue or loss of energy, feelings of worthlessness or excessive or inappropriate guilt, diminished ability to think or concentrate, or indecisiveness, having trouble making decisions. And again, for all these symptoms, you're comparing to the person's baseline. Some people in general are more indecisive than others, but when it comes to these symptoms, we want to look at what their baseline is like, and then how are they feeling and behaving now. And then recurrent thoughts of death or suicidal ideation, which can take a few different forms. So there's this idea of passive versus active suicidal ideation. Passive suicidal ideation is thoughts about how maybe you wish that you didn't wake up in the morning, or you feel like, what's the point of life? I wish I was never born, I didn't exist, or I died in my sleep. Active, on the other hand, is where someone is having active thoughts of, maybe I should end my life, maybe I should take some action to end my life. The next level is with or without a plan. So someone can have a plan for, okay, I plan to take my life this way, or I don't have a plan, but I know that, but I'm considering doing something. And one thing we want to look at is also a history of suicide attempts, because a big predictor of future suicidal behavior is past suicidal attempts as well. So when it comes to symptom number 9 here, it could be suicidal ideation. It could also just be recurrent thoughts of death and thinking about death a lot, even if it's not related to suicide, to one's life ending. Let's discuss some statistics now. So the lifetime prevalence, so the percentage of people who experience major depressive disorder at some point in their lives, is 7%, which is not a very low number. The highest prevalence rates tend to be in the age group of 18 to 29 years old. So it's not, like very late in life or very early in life. It's usually during this time period. It's where it's most common. Of course, it could happen at any point in life. The female to male ratio is 2 to 1, and some studies suggest even 3 to 1. So it's definitely more common amongst females than males. An interesting statistic related to suicide and gender differences is that more women attempt suicide than men, but more men complete suicide than women. And there are different theories as to why this may be the case. Some say that it's related to, the methods that are chosen by men versus women, and men perhaps choose more lethal methods, such as using a gun. Others give other explanations, but this is called like the suicide paradox when it comes to depression, which is that there are more women who are attempting suicide, but when it comes to completed suicide, it's more men. And I've seen a statistic almost where it's 3 times more in men than women. So 75% of men are completing suicide, and only 25% of women. This brings us to the other disorder I mentioned in the beginning of the seminar called persistent depressive disorder. And it's very similar to major depressive disorder with two main differences. First, it's more chronic. So to be diagnosed with persistent depressive disorder, which used to be known as dysthymia, you need to be experiencing symptoms for 2 years. Okay, so that's why it's called persistent. It's a longer duration of 2 years without having more than a 2-month break in between. So if someone's feeling better for like 6 weeks, but then they get back to their depressive symptoms, then they would still meet criteria. But if there's a 2-month break in between, then the clock starts over, so to speak. So it's more chronic, and it's fewer symptoms. You only need depressed mood plus 2 more symptoms, so a total of 3 symptoms to be diagnosed with persistent depressive disorder. Now, you could have both major depressive disorder and persistent depressive disorder. You could have persistent depressive disorder with also experiencing major depressive episodes. So, if you have 2 weeks where you meet full criteria for major depression. So there are different variations of all this, obviously. But it's just good to be aware how sometimes people are experiencing a more severe level of depression. Sometimes it seems a bit less severe in the sense that there are less symptoms, but it's more chronic. And it's also causing clinical levels of distress, which means a lot of suffering pretty much, and functional impairment. So impairment in someone's daily functioning. So it's not to be taken lightly either, but it has a little bit of a different presentation. Let's discuss some therapy options for depression. So a very basic, simple one is called behavior activation, which we'll talk more about soon. Cognitive behavioral therapy, acceptance and commitment therapy, and many other therapies. But these are the ones that I'm going to be discussing in this seminar. And you could also have a combination of all three. So combining behavior activation with some CBT and some ACT can be the best recipe. So let's get into the behavior activation model. And as I said before, it's pretty straightforward. The idea behind this model is that when someone is depressed, they are less likely to engage in activity, so it leads to inactivity. And the less someone engages in activity, the more someone is inactive, the more depressed they feel. And this is a very simple cycle that repeats itself. So I'm feeling kind of down. I don't want to do anything today. I stay in bed. 6 hours later, I'm still in bed. I feel kind of worse. Now that I feel so bad, I really don't want to get out of bed. And it just goes on and repeats itself. So as you can imagine, the intervention is to break this cycle. And you see here on the left side, we have the cycle from the previous slide. And then the idea here is that, yes, it's going to take some extra effort now to engage in activity because you're really not interested because you're feeling depressed. But as long as you, put in some extra effort now and begin with some behavioral activation, which means just engaging in your life again and doing activities, then it's going to start becoming self-reinforcing. Because when you get out of bed and you go outside and you see your neighbor and you talk to them for 2 minutes, you start feeling a little bit less depressed. And now that you feel less depressed, you're more likely to want to engage in more activity. So the same cycle that kind of keeps you depressed can also be turned on its head, where you push yourself to do some activity, you feel less depressed, you feel happier about yourself, better about yourself, you want to do more activities, you feel even better. And this is a very simple, straightforward approach to dealing with depression. So here you have a list over here. This is considered behavioral skill. And you have a list of all different categories you can choose from to pick activities from. So I actually have many lists of activities, hundreds of activities that I can give out to my clients, and they could say, okay, of these activities, this one speaks to me, this one speaks to me, and let's start picking ones that are a little bit easier to get going. When it comes to the types of activities you want to choose, we're keeping in mind two things. One is enjoyment, pleasure, fun, right? So you want to pick activities that are enjoyable, that are fun. And two, you want to pick activities that are meaningful. So you can have some activities that are fun, some that are meaningful, some that are both fun and meaningful. But those are the two things you're keeping in mind when you're choosing what type of activities to do. You want them to be um, to, to be able to cause you pleasure, but also feel meaningful. All right, let's get now into CBT therapy, cognitive behavioral therapy. So the basic conceptualization, and again, you can check out my video on CBT, where I speak more about it in more depth. But the basic conceptualization is what you think and do affects the way you feel. All right. So when it comes to depression, once again, the way you're thinking and the way you're behaving is affecting the way you're feeling. It's not that simple that thoughts cause behaviors and cause feelings. There are bi-directional relationships, and so everything is kind of intertwined with each other, where the thoughts you're having are affecting your behaviors, which are affecting your emotions. The emotions you're having are also affecting your thoughts. The emotions you're having are also affecting your behaviors. Bodily sensations play a role as well in terms of how you're feeling in your body physiologically. If you feel really tired and down and lethargic, that's gonna affect your behavior of wanting to stay in bed. So if we were to apply this to depression, some thoughts might be, my situation's hopeless. There's no point to anything. Um, it might also include thoughts of how no one's interested in me or no one cares about me. And so if you're having those thoughts, what emotions are you going to feel? You're going to feel really sad and down. And how's that going to make you feel in your body? Very heavy and tired and lethargic. And what behaviors is that going to um, affect or cause you to want to engage in? Probably not much, right? Probably staying in bed is the behavior. And then the more you're staying in bed, the more you're having thoughts now of, my situation is really hopeless. I couldn't even get up and do anything today. Or no one likes me because look, no one even spoke to me today. Yeah, you were in bed all day, so people didn't have so much of an opportunity to speak with you. But you can see here how all of these domains interact with each other. And so the therapy, therefore, comes in to help with each of these domains, to help you change your thoughts, help you change your behaviors, and ultimately change the way you feel. So in terms of some specific cognitive and behavioral skills, we have cognitive restructuring, which includes identifying distortions in your thinking, such as, is your situation really hopeless? Have you felt this way before and then your life got much better afterwards and you just need to remind yourself of that? You want to generate more accurate thoughts so that you're not thinking so inaccurately and negatively and pessimistically. There are, you can engage in behavioral experiments like, there's no point to do anything, I'm not going to enjoy it anyways, right? So let's do a behavioral experiment about that and see if that's true. Get up, do something, predict how much you're going to enjoy it ahead of time, see how much you actually enjoy it after the fact, and there you go. There's an experiment proving to you that even though initially you thought you're not going to enjoy it, you did enjoy it. And then behavior activation we spoke about before, which is a behavioral skill of getting up and doing things, as Nike says, just do it. Things that will cause you pleasure, cause you to have some meaning. These are the skills in a nutshell. And now let's get into a little more detail with these. So cognitive distortions are inaccurate ways of thinking. Some common ones in depression are all or nothing thinking. So if I'm not perfect, I've failed. My life's all messed up. Nobody likes me, right? All or nothing thinking. Overgeneralizing. So today was a really bad day, and from that you overgeneralize and say, okay, my whole life sucks. Even though today is the day that was really bad. Mental filter, you're only taking in evidence. You're only like noticing things that are in line with your negative way of thinking. So you're only paying attention to the 10 friends that did not reach out to you, but you're not paying attention to the 5 friends that did reach out to you. Disqualifying the positive is similar, where you say, okay, 5 friends reached out, but they don't really care about me, they just have pity for me. Jumping to conclusions, fortune telling, my life's over, catastrophizing. These are just some examples of cognitive distortions, but when we're thinking in these ways, in these unhelpful thinking patterns, then we are likely to feel depressed. And so once you identify these distortions, now we can work on cognitive restructuring, which is on the next slide. So for cognitive restructuring, this is a very basic sheet over here. We're trying to identify the automatic thoughts, such as nobody likes me, for example. What are the distortions there? So you're probably mind reading, jumping to conclusions, all or nothing thinking. And what's a more rational response? The more rational response might be, I have friends who like me, and there are those that don't like me, right? We're not trying to sugarcoat things, but we want it to be more accurate, not so skewed negatively. And when you go through this, you eventually start, it changes the way you feel. Like, how does it feel when you think that everyone hates you versus you have a lot of friends and only some people hate you? It's much better that way. What I often tell people with depression is we're not necessarily going to immediately get you from feeling like an F to an A. But even if you're feeling like an F and we're getting you now to a C, that might be all you need to get out of bed and do things, and eventually you'll start feeling better and better after that. Let's briefly talk about acceptance and commitment therapy. And again, for more information on this type of therapy, check out my video that's specifically on this model. But as we apply to depression very briefly, we're going to be looking at the following. We have the ACT model here, where the goal is to gain psychological flexibility through engaging with these different parts of what's called the hexaflex. So in depression, for example, we would ask someone to first identify their values. What are their values in life? Okay, now someone's values might be, for example, family or being healthy. And so then we ask, so what does committed action look like? What behaviors do you need to engage in so that you're going to be living your life in line with your values? And it might be spending time with family, getting up and going to work to support your family. It might be going to the gym or doing exercise or eating healthy. And we say, okay, so those are the actions that we're committing to that you need to engage in. Now we have a problem. You're feeling really depressed, and that's getting in the way of you engaging in these behaviors and ultimately getting in the way of you living the life you want to live. You're just staying in bed all day. So then we have skills to deal with thoughts in a way to help loosen them, as well as dealing with emotions to help loosen them and accept them so that you could go back to committed action, which is where you want to be at. So, for example, cognitive diffusion is a skill where you're creating distance between you and your thoughts. So, if let's say you have the thought, my situation is hopeless, or I'm a loser. So if you engage in some of the skills that I mentioned in the other seminar on ACT, you'll be able to create distance between those thoughts and yourself so that they're not so fused with you. They're not connected with you. They're not part of who you are. Instead, you can be observing your thoughts and saying, okay, I'm noticing my mind sending me the thoughts that I'm a loser, my life is hopeless. Great. Thank you, mind, for sending me those thoughts. And now, what are my values? What's my committed action? And that's what I want to get to. When you engage in cognitive diffusion, you feel like loosened up and being able to now start living your life without being so attached to your thoughts. And similarly with acceptance, you have this like pit in your stomach or you're feeling really weak. If you take some time and accept those feelings and make space for them and allow them to be there and not be so attached to them and not let them color your full experience, but just recognize like I am me, I have my values. I know what behaviors I want to engage in. And inside me, there's this feeling of like a pit in my stomach. Okay, great. So my feeling is there. But you don't have to be so attached to it. And therefore, you could go on living your life. And eventually, the feelings start feeling less intense. And then the other two parts are contact with the present moment is very helpful with depression as well. If you're saying my situation is hopeless, that means that you're thinking about the future. What about staying in the present? The present is not so bad. You're just worried about 10 years down the line. Or you're worried about the past. You're ruminating about the past. You're remembering situations or stories from the past that are making you feel depressed. But again, that's not in the present. So living in the present can be really, really helpful. And self as context, once again, is this idea of you are your context, not your content. So instead of saying like I am thinking and feeling all these like really rough ways and therefore I can't engage in my life, you want to become an observer of your experience, but not so attached to it. You don't want to feel like you're in a trance. You want to take a step back and say, I'm noticing these thoughts, these feelings. I'm engaging in, diffusion and acceptance to deal with them, and now I'm going to go on living my life. So that's ACT, very briefly, how we might apply some of those ACT principles to the case of depression. So to summarize, depression affects many people, females more than males by 2 or 3 times. It's most common in 18 to 29-year-olds. Treatment for depression, or more clinically, major depressive disorder or persistent depressive disorder, includes behavior activation. Just do it. CBT, changing your thoughts, changing your behaviors. ACT, which is changing your relationship to your thoughts and behaviors, but letting the thoughts be there without necessarily fighting against them or trying to prove them wrong, just letting them be there but not being attached to them. And through these types of treatments, people often tend to start feeling much better and being able to engage more in their lives. As always, a therapist can help you tailor treatment to your specific needs. So if you're feeling this way, it might be worth reaching out to a therapist to help you on your journey. Hope you enjoyed this video seminar. To see a full list of our current videos as well as upcoming videos that we'll be posting soon, visit us at adopsychologycenter.com and sign up to be notified when we post new videos. Bye for now.